Welcome back to the Morning Blend. If you're like me, you've spent a lot of time in waiting rooms, at doctor's offices, and urgent care. That's why our next guests are becoming very popular. They bring healthcare to you in your home, your apartment, dorm rooms, your office, wherever, even the soccer field. Dr. Andrew Culp is the Chief Medical Officer of Pivotal Health, a clinician house call service, and Jessica Dekan is the lead nurse practitioner. Great to see you guys. Thank you so much.
Thanks for having us.
For people who haven't heard of Pivotal Health, talk about the convenience of what you do.
So we set this up to bring healthcare into the 21st century in terms of people getting what they need when they want it, and especially where they want it. So we've always thought about going to the doctor, going to see the nurse practitioner or the PA in the hospital or the clinic. We want to turn that around. We want to let people in the Amazon age be able to order on their phone service to come right to them, and not have it be an extra expense.
I love that you just said the Amazon age.
Yeah.
It puts it in perspective.
Yeah.
People may wonder, and I think about this as a mom, am I going to get the same quality of care that I would if I visited an urgent care, maybe a facility I've been to before and have frequented?
Definitely. You definitely get the same quality of care, and you actually get a little bit more time with us as well. So you have a good 40 minutes sometimes with the clinician, and we bring all of our equipment right into your house, just like the same equipment that you would get in the clinic or the hospital.
So that's things like you can check blood pressure, you can do, can you do immunizations? Like a lot of people want the flu shot right now.
Yep, we have the flu shot, we have the COVID booster, we can bring that right to your house. We can bring all of our, like I said before, the equipment, the blood pressure, temperature. We also bring lacerations. We can suture lacerations right there in your kitchen if you need it.
What about people wondering about testing? So COVID testing, RSV, a lot of kids are struggling with now, flu, influenza.
So we can do the full array of point of care testing. So within 5 to 10, occasionally 15 minutes, we can do a COVID test, a flu test, strep, RSV, because RSV is really on the upswing right now during the winter season, along with urine, and then we can do a whole host of send out lab tests if we need, usually with next day results.
Nice.
If you need to do blood work.
Yeah, the convenience of it is incredible. And Jessica, I wonder about appointment scheduling, because that people may be wondering, well, how long is it going to take if I need urgent care?
Sure. So it's really easy to make an appointment. You can either call and talk to one of our specialists, our scheduling specialists, or you can download our app. Our app, you get to choose your time and why you want to be seen. And most often it's within an hour or two if you need it.
What about people who might have two kids who are sick, maybe even with the same thing? Could you see more than one person if the patient schedules enough time for that?
Absolutely. It's pretty common, actually. We'll see a group of students in a dorm who need all of their COVID boosters at once. We'll see a mom or a stay-at-home dad with their 2 or 3 kids that are sick, and we can do the whole group together. And it's so much more beneficial, obviously, for the parent, but especially the children who are used to kind of being triggered by going into the hospital or seeing the white coats and seeing all the sterile environment. They're in their own living room on their couch, watching a show or something, and we can come up and really evaluate them and see them in their comfort zone.
A lot more at ease. I started having my vet makes house calls.
Sure.
The convenience of not bringing, you talk about being afraid or being the comfort level has been incredible for our pet. And I think to be able to do that with your children, for an aging parent, for your spouse when they're sick, to have the convenience of an office, a home is just huge. You mentioned cost. I bet a lot of people ask about that because they might say, well, I have insurance. Do you do any things that are covered by insurance?
Yeah, that's really one of the big hurdles. Patients or prospective patients hear about us and they think that's too expensive. We are covered by almost all of the major national health insurance companies, along with a lot of the regional ones. So Medicare, Wisconsin Medicaid, United, Anthem, Blue Cross Blue Shield, which is about 70% of the Milwaukee market, and the cost is exactly the same. Okay,
wow.
So copay, if you need to pay it, we'll tell you up front what your deductible, what's remaining in your deductible on the mobile app, and we take care of the rest through insurance.
Amazing.
So there is no convenience fee for our services. This
Incredible.
is the same cost as going to the clinic or urgent care.
And it's possible in many cases to be seen same day,
Yes.
which I think
That's our goal.
Yeah, it's a lot of peace of mind that comes with that.
got it.
What about the areas that you serve? Because I know you've had a lot of success in Madison.
We have. Yep.
In the area, we serve Milwaukee, Waukesha, Washington, and Ozaukee County. So we go to all of them.
And one thing I also was wondering about is appointment follow-up, because I think that's one thing that people, you see a doctor, but then you might need something else. You have another question or another problem that arises or symptoms get worse, for example. Do you do those types of follow-ups even?
You bet. So a lot of in the traditional setting, which I'm used to, and Jess has been used to working in the urgent care and ER, you're not going to hear from anybody after a visit. They're going to say, go back to your primary, talk to your doctor. With us, we do an automated follow-up within 2 days to check in on the patients through our mobile app. So they'll get a text message to check in on them. And then if there are any outstanding issues, we will set up a follow-up, kind of a follow-up urgent care visit. When's the last time you went to the urgent care for a cold and they said, hey, let's plan on checking in and looking in your ear again in 5 days to make sure it's improving. Right.
Yeah,
right.
exactly. I love that you do that follow-up care. It's been a pleasure meeting you guys. I think that the service that you offer is huge for people. Thank you so much for being here. Want to make sure everybody knows again that Pivotal Health serves Milwaukee, Waukesha, Ozaukee, and Washington counties. You can download the Pivotal Health mobile app. Just search for Pivotal Health on the Apple App Store or the Google Play Store for Android phones. You can also easily schedule a visit by calling. Here's the number. It's 888-688-4746. And for more information, visit pivotalhealth.care.